Hi, I'm Adil Fattar and welcome to this series of videos. These videos are part of your consent process, which includes the consultation with me, the written information I gave you in the clinic, and the letters in the post. These videos are generic and an aide-de-memoire, so feel free to watch them as many times as you like, jot down any questions you have, and I'll go through them with you in the clinic at our next appointment. If you're not one of my patients, these videos do not constitute independent medical advice and shouldn't really be used outside of the context of a consultation with me. Either way, I hope you find these videos interesting and informative. What is a facelift? Everybody has their own idea of what a facelift is. In reality, it's a whole host of procedures put together to improve the appearance of the face. In this video, I'm talking about a lower facelift and a neck lift. These deal with the jowl area, the contour of the neck, and will lift the skin in this part of the face. Other parts of what are considered a facelift sometimes include a brow lift, upper and lower eyelid surgery. Facial aging occurs with two main parts to it. Aging of the skin, generally caused by sun damage, involves the fine wrinkling of the skin, blemishes and so forth. This isn't treated by a facelift. This is best treated by lasers, chemical peels, good skin conditioning treatments. The other part of facial aging is gravity. The face is essentially hanging off the skull. It's held by ligaments, and over the years these ligaments slowly stretch and parts of the face will sag. Where the ligaments don't stretch quite so much, they create dips, and around them other parts of the face will begin to sag. A facelift restores many of these features associated with gravitational aging. And there are many kinds of facelifts. Lunchtime facelifts, where they're performed under local anaesthetic and a bit of skin is taken. Threadlifts, which are short-lived but fit a niche and many patients are happy with them. Facelifts that involve stitching a tough layer called SMAS in the face, and deep plane facelifts. The technique I generally use is a deep plane facelift. I feel this is more long-lived, giving a better result for a longer period of time. However, other techniques may be used, and depending on individual circumstances, may be a better option for the patient. What happens after your facelift? When you come round after your facelift, you'll have a big bandage on. You'll look a bit like Mr. Bump, and this padding is used to try and minimise any risk of fluid or blood collecting. There'll also be two very small drains that exit behind your ears, and they'll be removed the next morning. Initially the face will look very different and not what you expect, and this is due to the swelling and bruising after the surgery. There's a degree of overcorrection that occurs because once this swelling and bruising goes, then you'll find that the skin relaxes back into a more natural position. Bruising occurs in the face and neck area and often tracks downwards towards the chest area. It's easily hidden with a scarf and usually takes 2 weeks or so to resolve. In most cases I suggest 2 weeks are taken off work in order to hide the fact that the facelift has been performed. If you work face to face with the public, you may want to take a longer time off work. The main sensation following your surgery is tightness, and this will subside over the following weeks. A common thing after this surgery is the numbness of the face, which takes several weeks to return. You will particularly notice this when taking a shower. The sensation is preserved in the middle of the face, but the remainder of the face remains numb. As the weeks go by, the area of sensation will return slowly. After your surgery, and before you go home, you'll be told to have a shower and wash your hair thoroughly, and apply ointment to the incisions. You'll also be given a small support bandage to wear for several days afterwards, together with some padding. The combination of daily showering and washing of the incisions, together with the padding, will optimize the healing process and give well-healed scars. After surgery, and for the first couple of weeks, you really want to avoid straining or putting the blood pressure up in the head area, which may cause a small amount of bleeding or bruising after surgery. This includes carrying heavy shopping, Also, in addition, due to the scars, you want to keep them clean and dry and away from any dirty environments such as house renovations or any other work to be done whilst you're having time off at home. Complications following surgery. The scar following surgery is in the hairline, around the ear, and often behind the ear. It's a long scar, but usually well hidden. But scar healing is individual and can vary from person to person. In the majority of cases, the scar is visible close up, but virtually invisible from a distance. However, in other cases, the hair can be more visible, especially if you wear your hair up. Some patients may have red or lumpy scarring. A typical scar will mature over a period of 2 years. In the first 3 or 4 months, the scar is red, lumpy, and may be quite visible, but by the end of the first year, it should be fading to pink or white. By the second year, it should be fully mature and virtually invisible. Sometimes a scar can be keloid in nature. This is a thick, lumpy area of scarring and may require further treatment, such as injection of steroid in the clinic or even referral elsewhere for help. It is very unusual, but it can occur. Scars can sometimes be tender. Scars can sometimes be sensitive. The scars may stretch a little, although this is unusual. Scars around the earlobe can place tension on the earlobe, pulling it downwards slightly. This is a telltale sign of a facelift. It's usually very mild if it occurs at all, but occasionally can be significant and is difficult to correct. Incisions through the hair are prone to temporary hair loss around the incision. For this reason, I sometimes use staples in the hairline to minimize this, as there are some anecdotal reports that staples are less likely to cause hair loss around an incision. Staples are removed around about 10 to 14 days after surgery. Skin pigmentation can occur following facelift surgery, typically as a slight tan or redness to the skin. It's usually in a patch and is unusual and often not noticed by the patient. It usually will resolve over several years, but it could be permanent. Infection risk is low in facelift surgery. I would estimate infection risk to be in the region of 2 to 5%. Usually it's treated with oral antibiotics. Rarely an abscess can form, and this may require washout in theatre using the incision for the facelift. You may need admission on IV antibiotics through a drip in order to treat this infection. Bleeding after surgery is a feared complication. Should it occur, you'd need to return to theatre as an emergency. The incisions will be opened, the bleeding stopped, the wound washed, and everything sutured back into place. It would cause greater swelling and a slower recovery, and could possibly affect the long-term result. Sometimes fluid can accumulate under the skin after the surgery, and this is called a seroma. It can be needled out in the clinic, usually through the numb area, and is very straightforward to perform. If it's a small seroma, it can simply be allowed to absorb on its own. A facelift is a procedure performed in the face where there's an awful lot of important clockwork and many nerves that control the sensation and movement of the face. The most important nerve in the face is the facial nerve that is responsible for the movements of the face. In my NHS practice, I'm a facial nerve surgeon and I'm comfortable working around this nerve, but nonetheless, everybody is prone to making mistakes and errors, and damage to this nerve can occur. It would be very unusual for the whole facial nerve to be damaged. The most common manifestation is a droop of the eyebrow on the one side, or an asymmetric smile, like this. In the vast majority of cases, if this occurs, it's temporary and simply due to stretching of the nerve. If it lasts more than several weeks, it may be due to quite a significant damage to the nerve, in which case we could use Botox to mask the effect and wait a little longer to see if things settle down. Very rarely it's permanently damaged, and there are many other procedures that can be performed in order to mask this asymmetry. Another more commonly affected nerve is the nerve that supplies the sensation to the earlobe. It's quite common for this to be abnormal following your procedure, but it usually returns to normal over time. Finally, I'm aware of cases of chronic pain in the face occurring after facelift surgery. I've not seen it in my own practice, but I have seen patients referred with this. This is not amenable to surgical treatment and is most likely a disorder of the nerve that requires medical therapy. Very rare complications of facelift surgery include skin loss. This would typically occur behind the ear. Wounds behind the ear can be treated conservatively with dressings and often can be concealed by having the hair down. Skin loss is much more common in smokers, and for this reason I avoid operating on smokers for facelifts. A salivary fistula could occur. Damage to the salivary glands, which occur here or here, could result in leakage of salivary fluid underneath the skin. This would require a number of other treatments to bring this under control. Aesthetic complications of facelift are perhaps the most common things. Patients are either unhappy that things have been undercorrected or overcorrected, or simply unhappy with a technically good result as it did not fulfill their wishes or meet their expectations or what the image of their face would be like in their mind's eye. And for this reason it's very important that we spend a lot of time trying to discuss this and work out what it is exactly that bothers you and how best we can achieve it. In some occasions, surgery is not the answer for you. In this age of people taking photographs all the time, the face will not look perfect at every angle all the time. There'll be things that you don't like at certain angles or show up in certain types of photographs. This is normal, even for the best looking models. And for this reason, surgery cannot promise a perfect result at every angle all the time. One of the things that I will guarantee is asymmetry, a difference between the two sides of the face. Everybody has a facial asymmetry, and that asymmetry will persist. Provided it is within normal limits, it's acceptable. Obvious, significant asymmetry, of course, would require treatment or management. The vast majority of patients are really happy with their facelift results. Sometimes patients ask me how long does a facelift last for, and a facelift isn't like Cinderella where the horse and cart turn into mice and a pumpkin and the whole face drops at 5 years. I explain to patients it's more like resetting the clock. The face gets taken back a few years in time and you continue to age gracefully thereafter. When we talk about the aims and expectations of facelift surgery, we try and gear it towards specific features of the face that we're dealing with, rather than a simply more youthful look. Youthfulness and attractiveness are subjective outcome measures and difficult to pinpoint, and what you regard as youthful may not be what I regard as youthful. And for this reason, we try and say we would improve the contour of the neck or lift the jowls. These kind of terminologies allow us to give a more objective idea of what we're achieving with the surgery.